The US military is conducting airstrikes on boats in international waters, meaning the open ocean doesn't belong to any country. They're saying that these boats are transporting drugs, specifically that they're part of a narco-trafficking operation, and ever since January, they've hit over 36 different boats and killed over 126 people total. Now, the big issue here is the Pentagon hasn't shown the public any proof that these people were actually drug smugglers. They're acting on intelligence, basically tips or surveillance, but they're not boarding the boats, making arrests, or going through any legal process. They're just blowing them up. Families of some of these people killed are saying that their relatives were fishermen and not criminals, and they've filed lawsuits. Legal experts are calling this extrajudicial killing, which means killing people without a trial or due process. There's also a practical question here. Most fentanyl entering the US actually comes from the southern border by land through Mexico and not on boats from South America. So even if these boats were carrying drugs, it's unclear if destroying them actually solves the fentanyl crisis. This next news is more straightforward but hits way more people directly. During COVID, the government created extra subsidies, essentially discounts to help people afford insurance through the Affordable Care Act marketplace, sometimes also called Obamacare. These subsidies made insurance way cheaper for about 22 million Americans. On January 1st, 2026, those subsidies expired. Congress could have extended them, but they didn't. So overnight, people's monthly insurance bills basically doubled. The average increase is about 114%, which means if you were paying $400 a month before, now you're paying around $850 a month. Some people are seeing even bigger jumps, closer to $1,600 or $1,700 a month. And this matters because when insurance costs so much, people are going to drop it. They can't afford it. Experts are predicting that around 4.8 million Americans will lose coverage this year, not because they don't want insurance, but because they literally can't afford it. The House of Representatives might vote this month to bring those subsidies back for 3 more years, but the Senate already rejected a similar proposal in December, so it's not looking good. So the bottom line here is you've got a situation where the government is spending resources on military operations in the ocean with questionable results, and then back at home, millions of regular Americans are losing access to healthcare because Congress didn't renew financial help that was actually working. That's the disconnect people are frustrated about.